Well, Mark, this is one of several labs in the country, in the state, that is looking at Omicron samples, but this is really the key one. This found the very first Omicron samples just a few weeks ago. They have sophisticated machines and sophisticated scientists to back them up.
We're here in the clinical virology lab at the University of Washington.
His name is Dr. Alex Greninger. He's the assistant director here at UW Medicine's clinical virology lab. Chances are good, if you've had a COVID test in Washington, it's come here for analysis.
We have a lot of automation.
And lots of people. Before COVID, 70 people worked in virology at the UW's medical school. With COVID, more than 200 do this kind of work. And this lab complex now covers 2 floors. Everywhere there are machines. Key step 1 is test positive or negative for COVID.
We're getting 500 positives a day. Probably tomorrow and the next day might be over 6. Well, we could be up over 600 or 700 positive a day.
That includes both the Delta and the Omicron variant. A second test trying to flag Omicron early by looking for a missing gene on the spike protein assigned the letter S.
The S gene target failures, I mean, you can hem and haw about this percentage point or that percentage point, but they're pretty spot on, honestly, at this point, especially with its growth, right?
The lab will then try to confirm by performing a full sequencing of the genetic code of a percentage of samples, but can't process them all. And Delta's days as the dominant strain appear almost over.
And the percentage of those likely to be Omicron are?
I'd say about 50% right now.
50%?
Yeah.
That's huge.
Maybe even higher, yeah. It was 37% on samples that were collected Monday.
He expects the lab to soon be processing record daily numbers of tests. Last Wednesday alone, they got 14,000 samples. Cases of Omicron doubling every 2.5 days.
We expect it to be the dominant strain by now/this weekend. And the question then becomes, if it's, does it completely sweep and take out all of Delta? Or is there any way, sometimes, some of the models, depending on the immune evasion, they could coexist.
And that's all part of the problem. The biggest part of the problem right now, in a way, is we are in the holiday season. We're about a week out from Christmas here, Christmas Eve, and a lot of people are going to be getting together, and he is equating the kind of wave he can expect to see coming out of the holidays and everybody getting together here and spreading this to what we saw last winter. Live in Seattle, Glenn Farley, King 5 News.